Hello students, today we will discuss one instrument which is very commonly used currently, mainly to take biopsy. Find out what is this. What is this instrument? Look at that, everything. So what is this? It's a Trucut gun biopsy. Look at the firing, this one. Look at the gun here, it fires and goes forward and fires. It got a sheath here, the sheath and inside needle is there. So when you fire, it goes inside and initially pass the needle, then once you fire, this inside needle will go inside and take a core of biopsy. So that is a typical of this instrument. That is a Trucut biopsy gun. Where it is used? It is to take core tissue biopsy. So commonly used in the breast. Breast it is Trucut biopsy. It's the ideal standard investigation, not FNAC. FNAC can do axillary lymph node. And many other areas currently it becomes all surface tumors, soft tissue sarcomas, surface swellings, and some areas when you do a CT guided biopsy, maybe from the liver or abdominal surface tumors, chest wall tumors we can do, where you are not close to the major neurovascular bundle, where you can do the Trucut biopsy. Thyroid, it is not very well accepted because compact area in the neck, when you fire the gun, you may injure carotid, vein and so on. FNAC is ideal. But breast and other areas, it is very useful. Breast lump, soft tissue tumor, prostate, neurology. Prostate, the investigation for suspected carcinoma prostate, when markers are PSA is high, is the Trucut gun biopsy. Correctly you do it and take around at least 10 samples you have to take. Same holds good for the breast lump and other areas. Many samples, not one or two. Usually 10 samples you have to take to have adequate tissue sample. So advantage of this is it gives a histological type, very assured and specific and with high sensitivity, and it gives the grading of the tumor, and also markers you can do that. Unlike FNAC, it's a cytological diagnosis, whereas the tissue diagnosis, more important, better always. And markers can be made, like in breast lump, if it is malignant, then ER, PR receptors, HER2 new receptors, Ka67, all those things, whatever needed, which is asked by the oncologist and or oncosurgeons, it can be done at a sitting and before planning any treatment. So it gives a proper roadmap to plan your treatment. Otherwise, olden days you do FNAC, then after do a surgery, and surgical tissue is taken for the molecular biology or tumor markers. So your planning will come after surgery. Here it is not so. Before surgery only you got a roadmap, planning roadmap. When you are going adjuvant, new adjuvant or other things, what type, what chemotherapy, what drugs, everything, because you got a grading, you got a molecular biology, you got a tumor markers, whatever it is. So entire plan for the treatment can be done by doing this one, unlike FNAC. There is the advantage of this. So usually currently most of the places surface tumors mainly, where major vessels are not close to this, it can be done very well. This is exactly tissues removed. Problem is bleeding, hematoma and pain. So advantages are adequate tissues are removed, markers, grading of the tumor can be done. So it's a Trucut gun biopsy. Currently in surgery it is very, very useful. Remember students. So this is my clinical book, everything clinical. It is with the video it is available. Surgical manual 7th edition or current edition, gives surgical principles. Operative surgery gives the technique of many surgeries, and tissue handling or suturing technique is very nicely come. And my DigiNow gives around 220 lectures of everything surgery, especially for UGs and postgraduates also in detail, so that you can go through my DigiNow lecture so that have the clear idea. Of course, read books also so that have a collaborative understanding. Thank you very much. So students, hope you understood my lecture very well. Thank you.